Dr. Jeremy Boyd, Trifecta Therapeutics, board-certified orthopedic sports physical therapist, located right in Glassboro, New Jersey. One of the most trained and highest credentialed sports physical therapists in the entire Philadelphia region. So he'll give us a little insight on this whole Joel Embiid injury, and unfortunately, this is what you come to expect. Doc, what's going on, man?
How's it going, Mike?
Everything is good? So here we go. This seemed inevitable, right? When we started this conversation between you and I and these injuries, Joel Embiid, a small lateral meniscus tear in his right knee. So kind of give us the lowdown on what, when you hear that, I come to you, that's my injury. Dr. Boyd, what happens?
Yeah, so the first thing we think of is, yes, you can be seen with physical therapy. That's usually the first line of defense for these type of injuries. So usually, I mean, it seems pretty terrifying, but that is something that we can definitely help out with. But being his type of profession, his position as well, and how they're at the tail end of the season or the playoffs, this adds some complexity to it. So I'm a little concerned, to be honest.
So it's a lateral meniscus tear.
Mm-hmm.
The Sixers said the injury will not be treated with surgery, but with physical therapy and treatment program. They're listing him as day-to-day. Does that make you feel any different?
The fact that they're listing him day-to-day does make me feel a little bit different. It probably says that it's a non-obstructive type of tear, especially with the meniscal tears. If it gets caught within the joint, those are a little bit more serious, and that means they're probably going to go down the surgery route, and that's going to be 6 months right there. But still, nonetheless, if it's an acute tear, it's a fresh one, it's still going to take time. I don't think he'll be back by the end of this series, and I'd be surprised, if he's back up and running by the next series, whoever they play against.
It was reported that managing potential swelling and pain in the knee is going to play a significant part in how soon Embiid will return to the floor. So if you're just hearing, hey, it's a small lateral tear, how typical is that pain and swelling out of that knee area?
Yeah, I mean, it's going to definitely happen. That's just how the human body works, especially if it's an acute tear. If you MRI most individuals, especially of athletes and those sort of things, they're going to potentially have a meniscus tear, even if they don't have pain. So it is something extremely common in our asymptomatic or no pain patients. So it's really, when did that occur? And it seemed, based off of his history with having 2 knee injuries already this year, and this one was his right, which was the earlier of the 3 total. They probably have an MRI on that. So it seems obviously that happened, last night or 2 nights ago. So it's going to have to go through the normal physiology of swelling and loss of range of motion, potentially even loss of strength as well. So how quickly they can mitigate that and restore all that motion, get that swelling out, will really dictate whether he comes back sooner or later.
So if this is the injury, what kind of program, what kind of stuff is he doing? What kind of stuff would you be putting him through to get him back out there the fastest?
So main thing to start off with is, again, restoring that range of motion. Some swelling is helpful. It's beneficial. It is bringing nutrients to the area, but you do want to manage if it gets excessive. Too much swelling will actually lead to decreased quad strength and more loss of range of motion. So we start off typically with, manual therapy, any of our hands-on techniques. We have a lot of great of those on our, social media if you ever want to check them out. But that's what's going to restore that range of motion the quickest. Whether it's a joint technique, kind of like a manipulation of sorts, or some soft tissue stuff to kind of flush out that swelling. That would probably be the big things. And then, any other concomitant parts of that injury, whether it's a loss of strength or stability control, that's when the exercises come in. And then from there, we transition to like a return to sport program. So hopefully, obviously, there's a lot more on the line with it being the playoffs, so they're going to speed that all along. And he's going to have to, this is a pain tolerance thing. It's not going to be, all of a sudden he's going to feel great by the end of the playoffs. He's going to have to kind of grin and bear it for a little bit. So if he can do that, then he'll be able to play. But he won't probably be at 100% this quick in the
because
game.
we've heard, in the past, you guys in the NFL play with this injury. There's been times
Mhm.
where offensive linemen just, pain tolerance. We hear a lot of that. What's the possible of injuring it worse, though, if you go out there and play with this small lateral meniscus tear?
Yeah, you can. You can tear it even more so. They didn't go into the details of what style tear. There's 6 total styles. Hopefully, it was on the outside of the meniscus, which is going to has better healing than the inside of the meniscus, which is not doesn't have as much of a blood supply. But the lateral meniscus, especially, it blends into components of your ACL, so that's a risk, and it provides overall stability to compression and tensile forces, like pulling away and getting kind of pushed together. So if it's not quite right, or if you have additional swelling into the joint, and that messes up your strength and your stability or your control of the knee, yeah, we do have some risks of potentially some other injuries, more acutely in the next couple of weeks to months versus way down the road.
So if I say, okay, no surgery, the injury will be managed with the physical therapy, what is in your mind, you've seen a lot of these people come to you for this same injury. How long before they come to you do you say, you can go back out there and do strenuous physical activity?
This is a great it depends question on in the medical world. Again, really, really depends on how he tolerates things. I typically, most athletes shouldn't, push past a 6 or 8 out of 10 pain. So really, that's one thing, and that's very subjective on the client. But he's got to, go through all his return to sport things. So probably the earliest would probably be a thing in 2 weeks, and if that's at the end of the playoffs. The championships in July. So we're coming kind of close, and that would be the earliest probably. And then anything past that, you're probably looking more at the the month marker at minimum.
I figure 2 to 3 is like best case scenario,
Yeah,
right?
way best. So
day to day sounds a little optimistic.
yeah, and that's trying to keep hope for everybody. So who knows?
Not good. Dr. Jeremy Boyd, Trifecta Sports Rehab, Trifecta Therapeutics. Check them out, trifectatherapeutics.com. And he can help you out with stuff like this. And if you have something that's bothering you, he's board certified orthopedics, one of the top highest credentialed sports physical therapists in the entire state of New Jersey and the entire region. And I hope that was a good explanation for people to not maybe get your hopes up, but they do have the best of the best of the best out there working on them, I guess. So hopefully 2 to 3 weeks is the bare minimum. Doc, good to see you, man. Appreciate it.
Of course. Thanks for having me on, Mike.
Absolutely. Dr. Jeremy Boyd there here on the Sports Bash Live on 97.3 ESPN.